The United States faces a serious drug problem. Many people use drugs like cannabis and cocaine. The US also has a massive opioid crisis, causing many deaths. This is a complex issue with no easy solutions. We need to understand why drug use is so high in America. Many factors contribute to this problem. One key factor is the easy availability of drugs. Another is America's recreational drug culture, where getting high is often seen as acceptable. The high number of prescribed opioids has also fueled the crisis. This essay will explore these factors and their impact on American society. We will also discuss potential solutions to this problem. Addressing the drug crisis requires a multifaceted approach. We need to reduce drug availability, challenge cultural norms, and provide better treatment options. It's time to face this challenge head-on and work towards a healthier future. Drugs are readily available in the US. This easy access is a major reason for high drug use. Cannabis, cocaine, and opioids are smuggled across borders. They are also produced domestically. This constant supply makes it easy for people to find and buy drugs. Law enforcement agencies work hard to stop drug trafficking. However, the demand for drugs is high. This makes it profitable for criminal organizations to keep the supply flowing. The internet has also made it easier to buy and sell drugs anonymously. This makes it harder for authorities to track and stop drug deals. The easy availability of drugs is a major challenge in the fight against drug abuse. It's like trying to empty a bathtub with the faucet still running. We need to reduce the supply of drugs entering and circulating within the US. This requires stronger border control, international cooperation, and effective law enforcement strategies. American culture often glorifies drug use. Movies, music, and TV shows often depict drug use as glamorous or exciting. This can make it seem cool or normal, especially for young people. Peer pressure also plays a role. Many people start using drugs because their friends are doing it. Furthermore, many Americans use drugs as a way to escape their problems. Stress, anxiety, and depression are common reasons people turn to drugs. They offer a temporary escape from reality. However, this escape is short-lived and often leads to more problems. The recreational use of drugs is deeply ingrained in some segments of American society. Changing these attitudes and behaviors is crucial. We need to promote healthy coping mechanisms for stress and provide young people with accurate information about the dangers of drug use. High drug use has devastating consequences for individuals and society. Drug addiction can ruin lives. It can lead to health problems, financial ruin, and broken relationships. Overdose deaths are a tragic consequence of the opioid crisis. Thousands of Americans die each year from opioid overdoses. Drug-related crime is another serious problem. People under the influence of drugs may engage in risky behavior, including driving under the influence, theft, and violence. This puts themselves and others in danger. The cost of healthcare, law enforcement, and lost productivity due to drug abuse is enormous. The impact of drug abuse extends far beyond the individual user. It affects families, communities, and the nation as a whole. Addressing this issue is not just about helping individuals break free from addiction, it's about protecting the well-being of our society. Section 5. Pills Gone Wrong: The Rise of Prescription Opioids. The opioid crisis is a significant part of America's drug problem. Opioids are powerful painkillers. They are often prescribed for chronic pain. However, they are highly addictive. In recent decades, there has been a sharp increase in opioid prescriptions in the United States. This increase is due to several factors. Pharmaceutical companies aggressively marketed opioids to doctors. They downplayed the risks of addiction. Doctors also became more willing to prescribe opioids for pain management. This led to a surge in the number of people using and becoming addicted to prescription opioids. The overprescription of opioids has had devastating consequences. Many people who became addicted to prescription opioids turned to heroin or fentanyl when they could no longer obtain pills. These illegal opioids are cheaper and more potent, increasing the risk of overdose. Section 6. From Medicine to Misery: The Cycle of Addiction. Addiction is a chronic, relapsing disease. It changes the brain, making it difficult to control drug use. People who are addicted to opioids experience intense cravings and withdrawal symptoms. This makes it extremely hard to quit using drugs without help. The cycle of addiction can be difficult to break. People may start using opioids as prescribed by their doctor. However, they may develop a tolerance, needing higher doses to achieve the same effect. This can lead to physical dependence and addiction. When someone tries to quit using opioids, they experience withdrawal symptoms. These symptoms can be severe, including nausea, vomiting, muscle aches, anxiety, and insomnia. This makes it very difficult to stop using drugs without professional help. Section 7. A society in pain: underlying causes of drug abuse. To effectively address the drug crisis, we need to understand the underlying causes. Why do so many Americans turn to drugs in the first place? One reason is the prevalence of pain. Millions of Americans suffer from chronic pain. Opioids offer relief, but they also carry a high risk of addiction. Another factor is mental health. Many people use drugs to self-medicate for conditions like depression, anxiety, and PTSD. However, drug use only masks the underlying problems and can worsen mental health over time. Social isolation and lack of opportunity are also contributing factors. People who feel disconnected from their communities or lack purpose in life may be more vulnerable to drug abuse. Addressing these social determinants of health is crucial in preventing drug abuse. Section 8. Breaking the cycle. Addressing the root causes. Breaking the cycle of drug abuse requires a multifaceted approach. We need to reduce the supply of drugs, but we also need to address the root causes of demand. This includes improving access to mental health care, addressing social isolation, and creating opportunities for people to thrive. One crucial step is to expand access to affordable, quality mental health care. Many people struggling with addiction also have co-occurring mental health disorders. Treating these underlying conditions is essential for long-term recovery. We also need to create communities that are supportive and inclusive. Social isolation and lack of belonging can contribute to drug abuse. Fostering strong social connections and a sense of purpose can help prevent drug use. Section 9. Prevention and education: empowering future generations. Prevention is always better than cure. Educating young people about the risks of drug use is crucial. We need to provide them with accurate information about the dangers of drugs and teach them healthy coping mechanisms for stress and difficult emotions. Drug prevention programs should be evidence-based and tailored to specific age groups. It's important to start early and reach children before they are exposed to drugs. Parents, educators, and community leaders all have a role to play in preventing drug abuse. We also need to change the narrative around drug use. Instead of glorifying drug use, we need to promote healthy lifestyles and positive role models. By empowering young people to make healthy choices, we can prevent future generations from falling victim to drug addiction. Section 10. Treatment and recovery: offering a helping hand. Addiction is a treatable disease. People who are struggling with addiction need access to effective treatment options. This includes medication-assisted treatment, counseling, and support groups. Treatment should be individualized and address the unique needs of each person. Stigma is a major barrier to treatment. Many people are ashamed to seek help for addiction. We need to create a culture where people feel comfortable asking for help when they need it. Recovery is possible, and everyone deserves a chance to heal. Support for families is also essential. Addiction affects not just the individual, but also their loved ones. Providing families with education, counseling, and support can help them cope with the challenges of addiction and support their loved ones' recovery. Section 11. A collective effort towards a healthier future. Addressing the drug crisis in the U.S. is a collective responsibility. It requires a collaborative effort from government agencies, healthcare providers, law enforcement, educators, community organizations, and individuals. We need to work together to create a society where everyone has the opportunity to live a healthy, fulfilling life, free from addiction. By reducing drug availability, addressing the root causes of demand, promoting prevention and education, and expanding access to treatment and recovery services, we can make a real difference. It's time to end the stigma surrounding addiction and offer compassion and support to those who are struggling. Together we can create a healthier future for all Americans.